Hello friends, let us now learn about the collapse of the left lower lobe. So in the collapse of the left lower lobe, so here whenever there is collapse of left lower lobe, first and foremost this is the lungs, and here we have the right lung and left lung, and this is the heart border. Now whenever there is collapse of the left lower lobe, again the oblique fissure which is present here in the left lower lobe, the oblique fissure will move posteriorly. Oblique fissure will move actually posteriorly and medially, and because of this movement of oblique fissure posteriorly and medially, this will result in a lateral triangular density. Here there is a density, a lateral triangular density is seen superimposed on the heart like this. Here you will see presence of a lateral triangular density which is superimposed over the heart. Now, second important thing is the about the hila. The hila of the left. Now, the second thing is the hila will lie below. Hila lies at a lower level than usual. So whenever there is this lower lobe collapse, there is hila will decrease, or it lies at a lower level than usual. And one important thing is here we have a descending pulmonary artery. Okay, this is the descending pulmonary artery. So this descending pulmonary artery which is normally present is not visualized, because descending, or if you say, you can say that this is lower lobe pulmonary artery. So here because of this, the left lower lobe pulmonary artery, this left lower lobe pulmonary artery is not visualized clearly. Next, and even we have the dome of diaphragm. The medial aspect of the dome of diaphragm is also obscured. Because of this, the dome of diaphragm will be like this. Now because of this opacity, this dome of diaphragm is not visualized. So as a result, it is mainly seen in the medial aspect. So fourth point is medial aspect of left dome of diaphragm is not visualized. Aspect of left dome of diaphragm is obscured. Then one more important thing is the vertebrae. Here obscured, okay. Then we also have vertebrae. So if you see the vertebrae, now these vertebrae are present here, okay. So this vertebrae, because of this vertebrae, the lateral margin of the adjacent vertebrae is also effaced. So here even the lateral margin of adjacent vertebrae is effaced. So these are the main features of left lower lobe collapse. So first and foremost, the oblique fissure comes posteriorly and medially, and as the result of this oblique fissure becoming posteriorly and medially, this displacement will result in a triangular density which is seen to be superimposed over the heart. Then the hila will lie at a lower level. Then there is normally left lower lobe pulmonary artery is present. Here the left lower lobe pulmonary artery you can see like this. This left lower lobe pulmonary artery is also not visualized. Then in the diaphragm, the medial aspect of the left dome of diaphragm is also not seen clearly. Similarly, if you see the vertebral body, the lateral margin of the adjacent vertebra or nearer vertebrae is also not clearer. So if you see the picture here, there is collapse of the left lower lobe, which is seen as a triangular density which is here superimposed over the heart. It is present over the heart. Then the left hilum is also at a lower level, and this descending pulmonary artery which is seen, which is normally present, is also not seen here clearly because of this obscuration of the, because of this collapsed part, that is the triangular density. This descending pulmonary artery is also not clearly seen. whereas this medial aspect of the diaphragm is also not clearly seen. Even the vertebral column, the adjacent vertebrae are also not clearly seen in a left lower lobe collapse. So this is the picture of left lower lobe collapse. Similarly, on the lateral view, the left lower lobe collapse. This is the left lower lobe collapse. Here the oblique fissure, if you see, it is moved posteriorly and it forms the anterior border of the increased density. So obviously actually it is moved posteriorly. So it is seen as a triangular density which is present behind the heart. Because it is a triangular density and present behind the heart, so the heart is obscured or not, the heart the over the heart you will see this density has a triangular density. So if you see this picture, this is the heart, this is the collapsed lung, this is the triangular shadow which is seen superimposed over the heart. See, you might label this as a normal image by just looking at the borders, but on careful examination you can see that this area does not have any bronchovascular markings. So absence of bronchovascular markings and a separate high density of high density or this triangular sign which is seen over the heart or present over the heart, these will help us to detect the left lower lobe collapse. Similarly, in this picture also there is a triangular density which is present over the heart. Even the medial border of diaphragm is not clearly visible. Similarly, the adjacent ribs, the adjacent vertebrae are also effaced. So all this will help us to diagnose the left lower lobe collapse. Similarly, in this picture also, this is the triangular density which is seen which in left lower lobe collapse. If you can clearly see, this is the triangular density which is traceable. So the left hilum is also not visible here. Even here, see the right hilum which is clearly visible, but the left hilum is not clearly visible. So with the help of these, we can differentiate between normal picture and the left lower lobe collapse. Thank you.